Hello, I'm Sheryl McCarthy of the City University of New York. Welcome to One to One. Each week, we address issues of timely and timeless concern with newsmakers and the journalists who report on them, with artists, writers, scientists, educators, social scientists, social activists, government leaders. We speak with each one to one. In the 40 years since the Civil Rights Movement, Black men and women have made tremendous progress politically, educationally, and economically, yet our poor health status persists. We are, in fact, in the midst of a full-blown health crisis. We die at a higher rate from every major disease than any other racial or ethnic group in the United States, and suffer disproportionately from heart disease, heart attacks, stroke, high blood pressure, hardening of the arteries, diabetes, and obesity. Black men also have more cancers of the lung, prostate, colon, rectum, and stomach than white men, while Black women are more likely than white women to have colon cancer. There are a number of reasons for this health crisis, but in her new book, Reclaiming Our Health, A Guide to African American Wellness, Dr. Michelle Gourdine discusses what steps African Americans can take themselves to become more healthy. Her book has just been published by the Yale University Press. Welcome.
Thank you.
In my introduction, I listed some of the discrepancies in the health of African Americans versus other groups. As Marvin Gaye once said, what's going on?
That's a great question. And that's really the impetus behind my writing the book. When I was in medical training, I learned all of those statistics that you just stated. And it occurred to me that those were not just matters of fact that were to be viewed from a distance, but they impacted me and they impacted my family and my friends and loved ones. And so I wanted to explore what in the world was going on, what's behind all of these statistics. And what I found was that there are cultural and environmental factors that have a huge influence on our health and predispose us to developing those conditions. And that's really what this book is all about, because one of the things I wanted to understand was what motivates us to take actions or to not take actions to protect our health. And once we identify what those motivations are, to provide some practical information and steps that individuals can take, and that's what can be found in the book.
Now, we often hear about some of the, environmental reasons that affect Black people's health. Our environmental racism, the fact that it's hard to find affordable and fresh produce in some low-income neighborhoods, or the mold and lead paint in buildings. But your book seems to focus on some of the behavioral patterns in the Black community, and and how that affects our health. And one of those factors, obviously, is diet.
Yes.
Fat, sugar, and salt.
That's right. That's exactly right. Those are the top three culprits, no matter what your race or ethnicity is.
But especially for African Americans.
That's exactly right. That's exactly right. So when you take a look back at our traditional diet and some of those things that some of us may have grown up eating, I certainly did. I grew up in Mississippi and ate good Southern cooking, which unfortunately tended to be high in fat, sugar, and salt. But when you examine the impact of those three factors on our health, you begin to understand the link between a high-fat diet and increased risk for heart disease and high blood pressure, and a high-salt diet and our increased risk for high blood pressure. And so what I wanted to do in this book was to take a look at those factors, because to be honest with you, and I'll give you an example of myself, in going through medical school, obviously one of the things I had to learn about was nutrition and what was good to eat and what was not good to eat and the impact that food had on diet. Yet that knowledge alone was not enough to deter me from eating some of those good things that I loved to eat based on my upbringing. It didn't deter me from eating fried chicken. It didn't deter me from eating rice and gravy, those types of things that might contribute to poor health. And so it seemed to me there was something more than just having knowledge about what's good for you or not good for you that was important. And to me, that missing link was culture, because in African American communities, as in other communities, food is not only a means of sustenance and nutrition, it is an opportunity for us to gather together, to fellowship. We mourn around food. We celebrate around food. Food has a great deal of meaning in our society, and I understood that viscerally. And so what I sought to do was to figure out, okay, how do we maintain those cultural values and traditions that we hold dear while not jeopardizing our health, given the true and stark facts of our current health status.
Well, you're probably going to have to give up some of the fried chicken and some of the biscuits, right?
That's absolutely right. You do have to give some of them up. That's absolutely right. And so what substitutions do you make? Is it true that all things in moderation are okay? Those are the types of things that I explore in the book.
But you also talk about heft as seen as a healthy thing.
Absolutely, absolutely. You know, in fact, one of the sort of nicknames that we use when we talk about somebody that's overweight, certainly in the South, is, oh, she's healthy, or, oh, he's a healthy boy. And by that, we mean that people are heavy, they're overweight. But it's ironic that we use the term healthy because overweight is not healthy at all. In fact, overweight and obesity, and African Americans, unfortunately, are the most overweight and obese groups in this country. 1 out of every 2 African American women is overweight and obese. 2 out of every 5 African American men is. And this condition is a gateway to type 2 diabetes, to heart disease, to high blood pressure. And so the fact that that is the case is not enough to motivate us to lose weight, because we tend to view an ideal body image in the African American community very differently. We don't necessarily view stick-thin women as being attractive.
You take me back to high school, where the expression that the guys had for an attractive young woman, she's fat and fine.
That's right. That's exactly right. You know, and to bring it in more modern terms, some men like women with a little junk in their trunk. You know, so those types of motivations need to be acknowledged in order for us to be able to provide practical information that people are going to follow that will motivate them to lose weight. If you don't think you have a weight problem, why would you be motivated to lose weight?
You also talk about the mixed messages that blacks send to other blacks who may be trying to eat more healthily or might be trying to exercise.
Yes.
I know my mother will tell me, when I tell her I'm riding my bicycle almost every day, I'm going to health. I think you're doing too much.
Yes,
yeah,
that's absolutely right. And I even caught myself the other day, I have to confess. I was with girlfriends, and we were out eating, and they were going to forego dessert.
Right.
Although they were looking sort of longingly at the dessert tray, and I found myself saying, oh, it's okay, you can have a little bit of that, it's not going to hurt you. And I think we're well-meaning in doing that, but on the other hand, are we actually discouraging each other from making those healthier choices?
Right, right. Now, there has been so much publicity over the years about what constitutes a healthy diet. Eat lean meats and fish, avoid red meat and processed meats, avoid processed foods, bleached food, sugar, eat lots of fruit and vegetables and whole grains, avoid saturated fats and a lot of salt. We hear this over, and it's in the paper.
That's right.
You know, it's on television. So why aren't African Americans are they not hearing this?
We are hearing this. However, the messages themselves are not resonating because there are other barriers to our being able to heed those messages. First of all, we have to be very honest that there are a lot of mixed messages in the media. You know, I've heard in recent weeks about the issue around saturated fat, which is found in red meat. You know, for many, many years we said it was dangerous. I've heard recent studies that have suggested that it's not as dangerous as we thought. So what do people do with those sort of mixed messages? What I like to do is to try to keep it simple for people. You know, clearly, first of all, the whole salt issue is very important for African Americans. We have the highest rates of high blood pressure in the world. We also tend to be much more salt sensitive, which means that eating even a small amount of salt in many African Americans tends to raise our blood pressure higher than it does others.
Right. We
must cut back on salt. A half teaspoon a day is all you need. And most of the salt that we get does not come from the salt shaker. It comes from canned and processed foods. That's number one. Second of all, we don't eat enough fruits and vegetables. We need to eat more things that grow out of the ground. You know, this is basic information, and in fact, back in the day, as they say, we used to eat more fruits and vegetables and things that grew out of the ground. We had our gardens and we grew collard greens, and, you know, people used to bring fresh peas to my mother's house for us to shell and to eat. Those things are very important. Fish, eating fish is extremely important, very helpful, and that's something that I think has not changed. So sticking with that information that hasn't changed, I think, helps people to sort through all of this contradictory information.
Right.
And then furthermore, helping people to understand that doing those small steps actually can make a difference in your health, because I believe that perhaps some people don't believe that making those small steps actually does make a real difference. But in fact, it does. And the other thing I want to bring up too has to do with support, not only in terms of what we were talking about earlier with regard to negative messages that we may give one another, but going beyond that. Some of us live with what I like to call, and my girlfriend coined this term, food bullies. For example, there may be an individual in a household who's responsible for the cooking who has decided, I'm not going to fry chicken every other day. I'm going to bake, I'm going to broil, we're going to eat more steamed vegetables, we're not going to put fat back or ham hocks in our vegetables. But there may be another individual in the home who says, and I've actually heard people say this, they've come up to me and admitted this to me, I'm not eating that stuff. That's not the kind of food I want to eat. And so the person, be it a man or a woman who's responsible for the cooking, has to make a decision. I'm either going to cook 2 separate meals, which is very inconvenient and difficult, or I'm going to revert to eating what everybody in the house likes to eat.
Right.
Because I'm being bullied into eating things, although I would rather eat more healthfully.
Right.
So we need to be careful about how we respond to individuals who are close to us who are trying to do the right thing for their
Are
health.
African Americans less active?
Yes. Yes. And Black women are the least active of all ethnic
Really?
groups.
Okay.
Absolutely. Yes. Research has shown that.
And you say that one of the reasons is we don't like to sweat. Now I know I don't like to sweat, and because of our hair.
Yes.
You know. But yeah,
Yes.
you know, my husband says, he wants to work up a sweat. When I'm
Yes.
at the health club, I don't want to work up a sweat.
Although that is the key. Your husband's right. We do want to work up a sweat.
Okay.
But when I've talked to people about this before, some people think this is very frivolous, but it's very important. African American women, we don't, for the most part, have wash and wear hair. We spend a lot of time and a lot of money in beauty salons getting our hair done. So let's say on a Saturday afternoon, you've spent 4 hours and $100+ getting your hair done. You're going to be hard pressed to ask that same woman on Monday morning to go to the treadmill and work up a sweat and ruin that $100 hairdo.
But you're certainly not going to go swimming.
That's absolutely correct. And swimming is another excellent form of exercise. And so we need to address that so that we can provide practical information that will then remove that barrier and encourage that woman to work out. Suggest certain types of hairstyles, suggest certain types of hair products. You know, some people actually have weaves. I work out in the gym. Some of my workout classmates have hair weaves. I wear my hair short as many other women do. Some have braids. We figured out ways to sort of get around that whole hair issue.
Right.
But it's not something to be overlooked and to ridicule someone about. It's a real issue.
Right.
And so providing practical information that helps people overcome those barriers, like hair,
Right.
is extremely important.
Okay. We're going to take a short break. Then we'll be back with more with Dr. Sheryl Gourdine, author of Reclaiming Our Health, A Guide to African American Wellness, after the following message.
Shortbread, fudgy nut bars. How many trees in the cookie jar? 1, 2, 3, 4, 5, 6, 7.
The smallest moments can have the biggest impact on a child's life.
Go Dad, go Dad.
Take time to be a dad today.
John can hold his daughter. Marilyn can laugh with her sons. Raphael can play with his sister. Gregory can fly. None of this would have been possible without an organ donor. Keep life going. Sign up to be an organ donor today. You can register when you renew your driver's license or online at savelivesnewyork.org. The more New Yorkers who sign up, the more lives saved. One of them could be someone you love.
Welcome back to One to One. I'm Sheryl McCarthy of the City University of New York, and I'm talking with Dr. Sheryl Gourdine, author of Reclaiming Our Health, A Guide to African American Wellness. It's just been published by the Yale University Press. To what extent does stress play a part in the health of African Americans?
Stress plays a major part in all of our health, but certainly in the health of African
Are
Americans.
we more stressed out than other people?
Some would argue that. because there are certain stressors that all of us share regardless of our race and ethnicity. And then there are other stressors that we as African Americans tend to face based on race and on discrimination. And it's important to note that this discrimination does not have to be proven. It can be perceived. And in fact, that perception of discrimination, be it going into a shopping boutique and being followed around, or driving while black, those types of things, even perceived discrimination in the workplace, actually has a very negative impact on our health, specifically on our blood pressure. And, you know, needless to say, we don't need any other reason for our blood pressure to be elevated, because we do tend to have higher blood pressure than any other race, and that predisposes us to other illnesses.
So what can you do about stress?
Well, you know, you can't completely eliminate stress from your life. Into each life some rain must fall, as the saying goes. And the most important thing is to figure out how to handle it. There are certain coping mechanisms that African Americans have that have been passed down from slavery. I talk about stoicism and silence as ways of dealing with stress. And as an example, we are very good as African Americans, specifically African American women, at putting on a mask of serenity. Mm-hmm. You know, we can look like the picture of health, like absolutely nothing is going on, completely calm on the outside, while there's all types of chaos and turmoil going on within. And it's that chaos that's going on within our bodies that causes the release of stress hormones that cause all of these health problems. So that's stoicism, and then silence, not wanting to put our business in the street,
right,
not wanting to air dirty laundry in public, leads us to not want to talk to legitimate individuals, be it a minister or a healthcare professional or a mental health professional, not wanting to talk about those problems and holding in our stress and not finding healthy ways to vent that stress tends to create huge health problems for us.
Right. Now, smoking is obviously extremely bad for health. Everybody knows that. Do African Americans smoke more or less than other groups?
African Americans actually tend to
Probably
smoke a little bit less than other groups. However, the way that we metabolize the main addictive component of cigarettes, which is nicotine, is very different. We tend to hold nicotine in our bloodstreams longer so that it has a greater amount of time to do damage within our systems. We also tend to prefer mentholated cigarettes, and part of that, some people suggest, is due to the preferential marketing of mentholated cigarettes in our communities. In any event, mentholated cigarettes, it has been proposed, cause us to take longer drags on the cigarette, which causes us to take in more nicotine and hold on to that nicotine longer so that it creates greater problems.
Is one of the reasons for less favorable health outcomes among African Americans that we don't go to the doctors as often as we should, or?
Some of us don't. There are some of us who go quite a bit, and there are issues related to bias among physicians who treat African American patients, making presumptions about the types of treatments that we need that contribute to our health problems. But on the other hand, some of us don't. Some of us don't trust doctors. And some of that goes back to the Tuskegee experiments back 40 plus years ago, where individuals were not treated for syphilis. They were withheld treatment for that and suffered ill effects and died from that. So that mistrust is still lingering. But on the other hand, for those of us who do go, we need to go as informed patients and make sure that we're demanding the appropriate care for our conditions.
How much of the failure to get adequate preventive medical care is due to lack of medical insurance?
I think a good deal of it is. About 21% of African Americans are uninsured. And that means that we don't necessarily access the healthcare system as much as we should. We may not get the appropriate preventive tests in a timely manner, tests like blood pressure screenings and your height, your weight, your body mass index, your blood sugar. On the other hand, almost 80% of us do have health insurance. And unfortunately, our healthcare system tends not to promote preventive health to the extent that it should. We are much more skewed toward treatment and curative medicine as opposed to preventing illnesses from occurring in the first place. And one of the things that I wanted to point out in our book is that there's a lot that we can do individually and as a community to take care of our own health. Because think about it, even if you, in an ideal situation, had appropriate health insurance, were able to visit the doctor, and the doctor told you about prevention, if you're relatively healthy, you're only going to the doctor 1, maybe 2 times a year, which means the other 363 days, you're responsible for your health.
Right.
So this book explains what we need to do in those days that are intervening the days that we go and see the doctor.
So what do you recommend in terms of a basic regimen of preventive health care?
You know what? We all know this. We all know about eating right, about getting regular exercise, maintaining a healthy weight, not smoking, and going to see the doctor. And the whole point of this particular book was not to reiterate what we already know, but to figure out what keeps us from doing what we know we need to be doing. And that's why these cultural issues are so important, issues related to how we view our body weight, what we view as a normal body weight versus what we know is a healthy body weight, what we view as good eating versus what we know to be healthful eating. Bridging those gaps by addressing those health concerns, what we need to do in order to exercise and work up a sweat versus maintaining a good hairstyle.
Right.
Important things that occur in the African American community that create barriers to our being able to protect our health and live a healthy life.
Do you see well, Michelle Obama obviously has, I think she's targeting obesity in children. What do you think of what she's doing?
I think it's fabulous. I think it's absolutely wonderful. First of all, we're seeing a rise in childhood obesity that's unprecedented. We're seeing children who are being diagnosed with type 2 diabetes. When I trained in medical school 20 years ago, we used to call type 2 diabetes adult onset diabetes. We don't call it that anymore because we've got 10, 11, and 12-year-old children being diagnosed with that because of the obesity epidemic. 10-year-olds on high blood pressure medication because of the epidemic. So what the First Lady is doing is absolutely vital for our future.
Here in New York, Mayor Bloomberg has been trying to promote healthy diets by, some of the initiatives by the city have been banning the use of trans fats in restaurants, requiring restaurants to post the caloric content of their offerings, trying to promote healthier food in school cafeteria, not to mention, first smoking was banned in buildings, public buildings, and most recently in public parks. What do you think of those initiatives?
I applaud what Mayor Bloomberg is doing. It takes a lot of courage to do that. Not many elected officials have the political will to do those types of things, but he is clearly a public health-minded mayor. Trans fats in particular are terrible. There's no redeeming value whatsoever. They increase the risk of heart disease, and so kudos to him for banning those. Smoking is another issue, not only for the smoker in terms of increasing their risk of disease, but also for people who are exposed to secondhand smoke who don't smoke at all, who are at higher risk.
How about smoking in public parks and beaches? That's been pretty controversial.
It certainly has been controversial, but it's less so if you're an individual in a public park or a beach who, for example, is predisposed to asthma and are around someone who's smoking, who may exacerbate your condition, or if you have some other chronic lung disease and you're around that smoke. I think that there's always going to be this tension between individual rights versus the rights of the public. Right. However, I think that Mayor Bloomberg's intent in passing that ban is absolutely important in terms of protecting the public's health.
You mentioned the very high incidence of asthma in African American communities. What's the reason for that? And is there anything that we as a group can do about that?
It's thought that the high rates of asthma in the African American community are primarily environmental. For example, things that we're exposed to. Dust mites in homes, the prevalence of roaches, lead paint, the emissions from automobile vehicles for people who live in inner city close quarter areas. Right. All of those things tend to trigger asthma in not only children but also adults. And because African Americans are more likely to live in those areas where they're exposed to those particular environmental triggers, that's thought to contribute to the high rates of asthma. One of the most important things to do is to get good asthma care by a physician who is expert in treating asthma, to make sure you take your medications, make sure you see the doctor regularly to avoid those severe asthma attacks.
Are there any public policy changes that you would like to see that you think would improve the health of African Americans?
Absolutely, and a lot of those tend to be environmental as well. You talked at the beginning of the show about the lack of access to what I call the resources that we need to be healthy. I'm a physician. when I see my patients who are children and I talk to their parents and recommend that your child needs to eat more fresh fruits and vegetables, and yet they go home to a community that doesn't have access to fresh fruits and vegetables, that has corner stores that sell predominantly processed foods, then my advice is very hollow advice. When I tell my parents that their children need to get more exercise, yet they live in a community where it's not safe to go outside and play, and they might not be able to afford to join a gym or some other recreational facility, that's very hollow advice. We need to make sure the playing field is level and make sure that all of our individuals in all of our communities have equal access to the resources that we need to be healthy.
Well, it's certainly a huge problem and a huge challenge for the African American community and for the nation.
Indeed.
So, we're out of time, but I want to thank Dr. Michelle Gourdine for joining me today. Reclaiming Our Health, A Guide to African American Wellness, has just been published by the Yale University Press. For the City University of New York and 1 to 1, I'm Sheryl McCarthy.